YouTube. I'm
You
gonna
are.
go on IG. Hello, everyone. Happy Friday.
Hello. We're
All
still
right.
we're getting hooked up to Instagram, which is a challenge for my old brain.
You
Because I
do
don't
what you can.
I have to be on the site now. It's a little different than it used to be.
Okay, so now we're live on Instagram.
Okay, so let me see if I can. Okay.
Hope you can
So
see that we are
I
live.
can
Hi,
see
everyone.
you. So I sent you a request to join.
Perfect. I got it. That was quick and easy. Hello, hello. Happy Friday, everyone. We're waiting on Dr. Q.
Did you get my request on
I did.
Instagram?
Oh, I pressed accept. Hi, everyone. Happy Friday.
Hello.
Huh. It's not it's not letting Dr. Q in on
Uh,
Instagram. Let's see. Accept. Okay, I just sent you. It says sickle cell, it's unable to join
huh.
from my
Let
end.
uh
I just sent an invite.
okay.
Hello. Tell us where you are tuning in from today. Or if you have any questions, you can get us started with our very first questions for this Friday.
See, I don't have any audio
You don't have any audio?
on the Instagram.
Uh-oh. Oh, I'm so sorry you're in the hospital right now. I wonder if is it the weather? Does the weather trigger at all? Because I know a lot of us go into the hospital during like winter, spring season. Huh. Says Dr. Q's unable to join.
Yeah, let me just uh maybe I'll try again. Okay.
I'd love to connect and do a live with you about the state of sickle cell disease in Jamaica. I'd love that too.
Yeah.
That'd be awesome.
Okay, I sent you another request to join. See what happened.
So I accepted it.
There we go.
Oh, there he is. We got Dr. Q on. Hooray. All right. So I saw someone from Argentina. That's
Yeah.
awesome.
Welcome.
Welcome. I think I saw London, LDN, Nigeria. Thank you, Philly, Chesapeake, Virginia, and Rochester, New York. And we are in the Bay Area. And it looks like we got our very first question. So I think we can dive right into it. Thank you. Why does my leg swell after leaving the hospital? Could it be the fluids?
It could be the fluids, but it also, depending on what you do in the hospital, if you're pretty sick and you're in bed all the time, your the circulation to your lower extremities it can be a problem, and then your legs will swell up a little bit. That's why they sometimes put compression socks or on your legs, or they have these compression things that squeeze your legs to get the venous return happening. Um, if it goes away within a day or less after you get out of the hospital, that's okay. If it lasts for, a couple of days or something like that, I'd talk to your provider about that because it really shouldn't last very long. Once you get up and start walking around, it should go away.
Yeah, I
The
feel
other
like,
thing is if you can do it when you're in the hospital, try to get out of bed and walk around a little bit.
oh
That would
yeah,
help
that's
a
why I
lot.
hate when my mom comes and visits me in the hospital.
I know her mom,
Yeah, I
so yeah.
just wanna rest and chill, right? And recoup. She has me like running marathons on the different hospital floors. And I'm like, what are you doing, lady? But it's, to keep that blood circulation because,
Yeah.
if you're in bed for long periods of time, then that
The,
can cause
the
other
other
issues.
thing is you can get blood clots. If you don't,
Mhm.
that's why they put the compression socks and stuff on you. It's called venous stasis. It means your return, the venous side of your circulation is not functioning properly. So and people with sickle cell disease are prone to getting blood clots. So that's uh, something that you should really try to avoid. You talk to the nurses, maybe they could, or your doctor, whoever's taking care of you, that they can get you compression socks or have somebody help if you feel up to it, have someone help you walk a little bit in the room even would help. Just standing up, walking around, get those. You can also flex your muscles to get your circulation going. It's a problem. Anyone,
How do you know? How does somebody know if they have a blood clot in their legs?
you would have swelling on it wouldn't be both sides. It would be one side, it would be
Okay.
painful. So if you flexed your foot towards your body,
Hmm.
or you felt on your leg, that would be painful.
Like
Uh,
very painful or just like a
Yeah,
little
it would be
thing.
pain. I mean, it shouldn't be painful at all, but yeah, it would be painful.
And then there would be swelling as well.
Yeah, there'd be swelling. It may not be that much swelling, but it would be painful. Especially if you tried to get up and walk, it might be a little painful.
Okay.
And blood clots for sickle cell are a pretty big issue.
Yeah. So what I do while I'm in bed is I do these like with my
Yes.
feet back and forth, like
Yeah.
I'm swimming. I also do it when I'm flying too.
Oh
Like if I'm
yeah.
on long periods of flights and I'm not able to stand up and stretch yet, then in my seat I'll do that. And, just to make sure the blood keeps, pumping and circulating.
Yeah, it's nice to have an aisle seat so you
Yeah.
can get up, and if you have to go to the bathroom or something, you don't have to move five people out of your way. But yeah,
Yeah.
it's a big deal. It's not trivial. It's a big deal. Even in plane flights, even people without sickle cell don't have any major problems can have blood clots on long
Yeah. Yeah.
flights. Like some people who go to these weird places like Dubai and stuff like that, where you're in the plane for for a day.
Are you talking about me? Because I didn't even tell you about my upcoming trip yet.
Oh.
You
This is
guys,
the,
I think I might be going to Nigeria next month.
oh,
Yeah.
that's cool. That's cool.
So last time I was in Nigeria, I got really sick.
I
Like
remember
I yeah, I
you got a
got
free flight to the UK.
oh no, I didn't. I ended up getting everything resolved there, but I wish. Or maybe I did. I think I flew from the UK because I was staying in the UK for a little bit and then I flew to Nigeria. And guys, I had malaria medication that I ran out of because I didn't want to come back home. Like I want to stay in Nigeria. And so I ended up getting malaria. My whole self was sickle cell, got malaria, and then got acute chest and all the other stuff to go along with that and got very, 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 very sick. That was 2010, and I haven't been back to Nigeria since. So wish me luck.
So take plenty of those malaria pills, more than you need.
More than I need,
Yeah, don't put
yes.
them in your luggage,
I'm
keep
not
them
gonna
in your
extend my
pocket.
trip this time because I have like a husband and a child now, so I guess I gotta get home back home to somebody now. So I'm not gonna extend my trip, but anyways. Um,
Oh, somebody's son is coming from Nigeria today.
oh really?
Yeah, my husband
I
is
haven't
from
caught up.
Nigeria. My son is coming here today from Nigeria.
Oh, very cool. Yes, I'll be in Abuja. If anybody in Abuja wants to meet up, I'll be there for the Global Sickle Cell Conference. Actually, I'll be a panelist there. I'm supposed to be a panelist, and then I'm actually supposed to present a poster there too. So, how can you increase your baby's iron intake 6 months old?
Uh, if you're in the United States, all the baby cereals are iron. They have iron in them. Um, That's that's why they tell you to start with the rice cereal early with babies is because the rice cereal contains iron in the United States. I don't know about other countries, but in here that's where you get your iron. You don't want to give your baby iron drops or anything like that. Babies are growing fast and they do need iron, but you don't want to give them too much iron.
Are like babies iron deficient?
They're not iron deficient. They're just growing so fast. Some babies do need iron just to get their hemoglobin up. And
Okay.
a 6 month old still has lots of fetal hemoglobin, so their hemoglobin should be, normal. The other thing is you don't need to give, if you don't know what your baby's hemoglobin is, you don't really need to give iron, especially if they're eating that rice cereal.
Oh. Somebody said about 9 months ago I had sickle cell crisis, and 7 months ago I underwent eye surgery for sickle cell retinopathy. Um, I just lost it. Okay, for sickle cell retinopathy. However, even after the surgery, I'm still yet to regain my vision.
Hmm.
Do you know what could happen or what could have happened there?
Well, if the retinopathy was severe enough that you lost your vision, it means that your lens in your eye focuses the image onto a special part of your eye. And that's where the optic nerve is, and it sends the impression to your brain. Now, if that was involved before you had your surgery, it's it's you'd have to talk to an ophthalmologist, the person who took care of you, to see what they saw. But if it was actually damaged, it might not recover from the surgery because the surgery may have been to stop it from proliferating. But if you still haven't got your vision back, then I think you need to talk to the retinologist or whoever took care of that to see why they think you haven't. They probably want to take another look in your eye just to see what's going on. The other thing is sometimes if you have clots, you have bleeding into your eye, as that clot organizes, it compresses and it can pull the retina off the back of your eye, and that can also cause problems.
So I guess it was the state of your vision before you
Yeah,
got surgery done. If you were already blind or losing vision before the surgery, then the surgery might have not have fixed your vision, but stopped the problem from getting
yeah,
worse, if that makes sense.
yeah. You might ask the doctor whether you have retinal detachment, because that's hard to take care of.
And then another eye question. I was recently diagnosed with anterior uveitis in
Hmm.
my left eye after experiencing pain, redness, and light sensitivity. I'm wondering, does this occur in people with SC patients?
I don't think that's associated necessarily, you know, with hemoglobin SC or uveitis means you have some kind of inflammation or something in your eye, and I'm not sure that that is a common finding um, in people with SC, although people with SC have a lot more problems with uh, retinopathy than other people with sickle cell disease. Um, if you have that, then I think, and it's bothering you more, then I think you need to again get in touch with the ophthalmologist to see if things are getting better. They might want to take another look to see.
You said there was blood at the back of my retina before the surgery.
Yeah,
That was for
so
the,
that when that blood coagulates, it doesn't always do this, but it's a risk for having retinal detachment, which is one of the, you know, complications of having retinopathy in sickle cell. You have bleeding into your eye and then you have retinal detachment.
yeah. And I actually have sickle cell retinopathy too. I had to get the surgery. Luckily they caught it before it got like actually it was a kind of pretty big from what I told. Like the coverage or like the leakage was pretty substantial, but it was in a spot where I was able to get the injection first to kind of slow down what was happening, and then I got the eye laser surgery, which was so painful. I don't know if it was painful for you guys, but like my whole 37 years, like at my big age, I cried like a child. Like I was kicking my feet when they're doing the laser in my eyes. That's how much it hurt me. I don't know. I don't know if I have a higher sensitivity to pain. But yeah, I was like, I never, ever, ever want to do that again. So this is just to let y'all know to get your eyes checked on a annual basis. I did skip 1 year. I skipped 1 year and I found out that I had retinopathy. And you know who told me to go see an eye specialist, guys? Dr. Q. He's like, if you don't go see a specialist, I was like, okay, okay, I will. It's on my list. It's on my list of things to do. And I luckily I got there right in time for them to be able to fix things. I do have the floater still, so that obstructs my vision. But it's not persistent. It's just, sometimes I'll see the floaters. So, yeah. Somebody says I have it too. So what happens if it's not treated? Because the ophthalmologist I saw said I can live with it.
Well, you can live with it, but you need to see a retinologist. There are medicine is just cut up into all these little subspecialties. So an ophthalmologist is kind of a generalist, like a general practitioner. What you need to see is a retinologist, and depending on your insurance and all that kind of stuff. I don't know if you go to your primary care doctor and say that I've been told I have retinopathy. I want to see a retinologist to find out if I should get treatment because retinopathy doesn't stop. It doesn't like resolve on its own. It just gets worse and worse. So you have to get someone to take care of it. Now the laser therapy targets the little vessels that are a problem so they don't bleed. What happens is the vessels come off the back of your eye and they're very fragile. And if they break, they start bleeding, it bleeds into your eye, and that causes some problems. So you need to have that looked at. If you have retinopathy, you should see a retinologist, a specialist in the retina. And they're usually the people who do the laser therapy and stuff.
All right, I'm gonna switch gears. Somebody asked, is anybody, and I think this is for whoever's here, is anyone on Suboxone for pain management? And Dr. Q, is there any light you can shed for that medication?
The
I've never heard
box,
of
what is it? I haven't either.
Suboxone,
Suboxone. It could
Suboxone.
be a um let me look.
It is medicine. It's
Yeah, it's like
okay, so that's the brand name, Suboxone. It's
right, and it's a medicine. It says it's so what it is, it's a substitute for um opioids. And it's like there are these drugs that are used for pain uh, therapy in people who have sickle cell disease, along with other drugs. But it's for some. It says it's for dependence on opioid drugs such as heroin, morphine, etc. But some of those drugs are used. That type of a drug is used for pain therapy in people who have sickle cell disease because it's like methadone is an opioid substitute that a lot of people use that because it's a medication that you take to it's like uh, 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 I'm trying to think of what Buprenorphine is another one. That is the drug that a lot of people, it is, now that I look, that's the brand name for that drug. And so, yes, a lot of people use that for pain management uh, rather than other drugs. And it does apparently, I don't practice anymore and I didn't use it when I was in practice, but apparently it's effective for pain management in sickle cell.
hopefully that answers your question. Is
I was
anybody
told that,
on the
yeah,
live?
they said, I was told it helped pain and all I take now, I've never been on hydroxyurea or anything but pain meds. Well, you should be on hydroxyurea if you have pain. That's my mantra is hydroxyurea.
Okay. Anything. Yeah, because then you're just doing pain management, and pain management is always going to involve like, I don't know. I think of pain management as like putting a band-aid on something, not really like fixing anything, right? It's just addressing the issue in that moment
Right,
instead of like targeting anything underlining under like the underlying disease, which is what hydroxyurea does.
right. So there's hydroxyurea and L-glutamine and some of the other drugs have been taken off the market or they're not approved in every country, but those two are. So wherever you are, you should be talking to your provider about hydroxyurea at least. And if your provider is not a hematologist, they might be a little reticent about starting that because it requires blood work and um, it drains my energy. I don't know about people. That hydroxyurea works in most people, but somewhere 5% or less of people, it doesn't seem to be effective. I've never heard anybody tell me that hydroxy makes you tired or fatigued.
Yeah, it may not help with fatigue.
Yeah,
Because I'm
right.
on hydroxyurea and my hemoglobin is still lower. But I take it for, organ preservation to make sure that it slows down the speed of the damage of sickle cell. So that's why I take it. But it never boosted my hemoglobin level. Um, so yeah, I think maybe sometimes people expect that boost and therefore expect to be more energetic on hydroxy and that may actually happen for some people, but maybe not everybody. And so maybe that's what it was. Maybe it never fixed your fatigue.
You also have to have lab work and make sure that the dose you're on is what's called the maximum in this country or in developed countries, it's called the maximum tolerated dose because it requires blood tests to see to look at the side effects, which are mostly hematologic, to make sure that you keep giving the dose until it gets to a point where it's starting to look like uh, it's starting to decrease things, your white count and maybe even your hemoglobin a little bit, and then you back off and you find the maximum tolerated dose, which is different for everybody. So not everybody tolerates the same dose of hydroxyurea. If you take a lower dose, 10 milligrams per kilogram or something like that, then you generally don't have any side effects. And in places where that they don't have the ability to do blood work, you know, blood work and measure stuff, it's a low dose is effective in decreasing the symptoms of sickle cell disease. And it does, the idea with sickle cells or hydroxyurea in sickle cell is that if you start at a young age, it does decrease, it's been shown to decrease stroke risk. It's been shown to decrease pain episodes and other complications of sickle cell in children. I see someone has.
Yeah, what do you say? So, what do you say to somebody who says chemotherapy is not a reasonable treatment for sickle cell anemia disease?
Well, actually, it's been shown for the past 20 or 30 years that it is a reasonable not any chemotherapy, but hydroxyurea is very effective in treating sickle cell disease. Um, it has to be monitored more than other medications because it does have side effects. But all drugs have some side effects, but hydroxyurea in particular needs to be monitored to make sure that everything's going okay.
All right. What is your take on bone marrow transplant? My son has sickle cell disease SS and he's 8.
Right. So if you have a sibling, if he has a full sibling, then they should be HLA matched. When I was in practice, all children that came into my practice that had an older sibling, we HLA typed the newborn, well, when they were a few months old. We typed the baby and any siblings to make sure to determine whether or not there was an HLA match in the family. If there was, then that is the um, safest and most effective way to have a successful bone marrow transplant with the fewest amount of complications. And it turns out that the younger children have fewer complications than older children, adolescents, and adults. Now there are other types of they've improved the treatment for graft versus host disease, so you can have an HLA matched donor who's not a family member or maybe is a family member, just happens to be an HLA match. And then they have what they call haploidentical. So these are usually relatives that are a half match. And though that's another type of transplant that can be done, and it's effective in a vast majority of cases. Um, but you have to go when you go into a bone marrow transplant, you have to really talk to the transplanter and make sure you understand what the where the donor, who the donor is, what's the match, and the complications, even though they may only be 1 or 2%, 5%, you want to know what they are because you want to know what you're getting into when you get into a bone marrow transplant. But by far, they're you know, 95% of people or more survive, and at least 85 plus percent are cured of their sickle cell disease. But you have to have those numbers in front of you and the transplanter to answer your questions about transplant. Everybody's a little bit different. The match that you have may not be, maybe uh, not complete. So and there's 6 out of 6, 10 out of 10. You really have to talk to a transplanter about it. But yeah, it'll cure your sickle cell disease.
Neat. Um, this question says, is it better to have a pediatric hematologist than a normal pediatrician when going to wellness checkups? I am a bit confused. That's a good question.
That is a good question. I was a pediatrician, or I was a pediatrician. I wasn't a pediatric hematologist, but I took care of people with sickle cell disease, and I was just fortunate that I was at Children's Hospital in Oakland, where they had a sickle cell center, and so it took me about 2 years to really feel confident that I knew something about sickle cell disease, and then as I practiced over 20 years or so, I just got better and better. So you don't necessarily need to have a pediatric hematologist. Pediatric hematologists are actually oncologists as well as hematologists. So in the adult world, you have adult hematologists who only deal with what's called benign hematology, which means it's not cancer, and then you have adult oncologists. So oncologists don't do hematology, and hematologists will do hematological cancers. Um, at some point, but in some situations. But a pediatric hematologist is they know about hematology and oncology. And if they don't have experience with sickle cell disease, then they know about it, but you have to have a lot of patience and some experience to be good at it. A pediatrician would know very, very little about sickle cell disease. That's not, in my training and my residency, although I was at Children's, so there was sickle cell there. But if you weren't, you could never see a person with sickle cell disease as a pediatric resident ever, and then become a pediatrician and not really have that much experience.
So for wellness checks, which I'm assuming isn't, health outside of sickle cell, it would be a pediatrician that you would go and visit.
Yeah. So the other thing is you might need two doctors, but because I was a pediatrician, I could do things. There's a reimbursement thing about it. So sometimes if you're a pediatric hematologist oncologist, you don't get reimbursed if you give vaccines. You don't get reimbursed for, routine pediatric care. So, most doctors like to get paid for what they do. So if you're a hematologist, a pediatric hematologist, you may not be able to give, vaccines and just general pediatric information. So you'd need to have two doctors. And, doctors are really busy. So a pediatric hematologist may not have time to do the things. And even depending on where they are, their office may not even have vaccines because they just don't, that's not what they do. I was in a very unique, very fortunate situation to be able to be a pediatrician and take care of people with sickle cell. I didn't do any other hematology, only sickle cell.
Is it possible that pregnant women who is carrying a baby with sickle cell is in high risk of miscarriage?
Uh, no. Miscarriages happen early in pregnancy, and I don't think there's nothing about carrying a baby with sickle cell that would increase your risk of having a miscarriage. Babies with sickle cell disease until they're older, like 18 months or so, they have fetal hemoglobin, so they don't have any symptoms of sickle cell. They don't have any organ damage. They're pretty normal. I mean, there's no risk for that with a baby with sickle cell.
Okay, so there's no correlation there.
No.
Um, what is the best multivitamin with zinc that I can give a 4-year-old?
Uh, uh, it'd have to be a liquid, and I honestly don't know of any vitamin that has zinc in it. With zinc, zinc is okay. Zinc is good for your immune system, and it is a good mineral to be giving, but you can give too much. So you have to be careful about how much you're giving because zinc can is like iron. uh, there's can be side effects to giving too much zinc. And to a small child, you can't give them an adult dose of zinc. It has to be a children's dose if you want to do that. So you need to talk to your pediatrician about how old your kid is, how much they weigh, how much zinc you can give safely. You can give too much zinc and it has side effects. And I think someone did just slip by, but there are other ways to get zinc. So you can look it up. Our favorite Google, you could say vegetables and fruit or food that contains zinc, and then that you can do that. You can you know, give food that contains zinc rather than a multivitamin. In reality, really, to be honest, my opinion is you should just have a really good diet. People with sickle cell disease should have a good diet. They should have lots of vegetables, lots of fruit. They should be taking in lots of liquids. They need to get some protein from meat, etc. But you really you could probably get everything you needed just from your diet. You wouldn't really have to take vitamins at all.
Yeah, so Dr. Hughes a huge proponent of just eating healthy, eating whole
Yeah.
foods
Yeah.
to get your nutrients. Um, why does my blood have so many antibodies?
Is it well, I think you're I think you're talking about it's hard to get a transfusion because you're have alloimmunization to blood. So um African Americans and in Western countries, most of the or a lot of the donors are white or they're not African. So there are certain your red cell is covered with little proteins that have functions in the red cell. But what my phenotype or genotype of my blood would probably not match very well of someone who is from Nigeria or from Africa. So when you're exposed to these blood that has called an antigen or a protein on it that you don't have, you make antibodies against it. And so people with sickle cell disease should always be given phenotypically matched blood. Blood that the blood bank can test to see if your blood, not ABO/RH, but all these other proteins that are in your blood, they can find the closest match to you so that you don't develop antibodies. If they don't do that, if you just get like an ABO/RH matched transfusion like I would get, you're very likely to develop antibodies. And then there are certain really common antibodies among blood donors that or common antigens among blood donors that some people of African descent don't have. So then it's really hard to find blood because most people have this protein on their blood and you don't. So then you have to find special donors. So there is, in this country, there's a rare donor blood bank on the East Coast. And I did have a young kid who had to get all his blood from people generally in the population of the whole country. And so he would get blood from people who have these rare blood types are known to the blood banks. And so he would get like there was somebody I think in Georgia and South Carolina, maybe those two, there were two donors that were his donors. So if he needed blood, they would call those people, they'd donate blood, and they'd send it out to California for him because he had a very rare blood type.
Well, hopefully that answers your question. Yeah, and typically you gain antibodies through transfusions, correct?
Yeah.
Okay.
And you get antibodies because it could have been an emergency or somebody you were someplace where people didn't take care of where
Matching your
the
blood.
hospital didn't take care of people with sickle
Yeah.
cell disease very much, and they couldn't didn't ha it takes a special lab to do the phenotyping of blood bank. Not every blood bank, I don't think, does extensive phenotyping. And so if you were somewhere where they didn't do that and you needed a blood transfusion and the people taking care of you weren't sickle cell doctors, they might just say, oh, we got to give this person a blood transfusion. And they just grab a unit, ABO/RH matched, and then you could develop antibodies against blood. The more
Yeah,
antibodies you have, the more difficult it is to
the
find
harder.
blood.
Yeah, I think I have one antibody. So yeah, I mean, would you say it's common for people to develop antibodies with sickle cell who are getting
Yeah,
transfused?
right. And interestingly, if you're in Africa, they don't have a big problem with antibodies because the phenotype of the general population, matches the patient. So alloimmunization is less of a problem in Africa than it is here. And it's another reason why if you should encourage your friends, your African American friends, to be blood donors because they're the people who are going to match you when you need to get a blood transfusion. So you want to have minority people donating blood so that that blood can be used for people with sickle cell disease. And if you're a blood donor, if you're in some blood banks. If you're an African American in this country and you donate blood, they will phenotype your blood so that they will call you if you have a very rare phenotype to donate for somebody that they have in their that they send blood to at a hospital. So it's very, very important for African Americans in this country to be blood donors. Most blood donors are not African American.
What advice would you give to parents who have sickle cell children living in Nigeria?
Uh, they should be on hydroxyurea. And if you're in Nigeria and you're not in a big city, um, it's been shown that these lower doses of hydroxyurea that are never increased are important or decrease the symptoms of sickle cell disease. I think if you're in Nigeria, depending on where you are, Cassandra knows better than I do, but if you're not near a large city, if you're near a large city, you should have, a pediatric hematologist, or if you're an adult hematologist once a year or so to just make sure everything's okay and be checked out. If you're not near a big city, then even it may be even hard to get hydroxyurea, but I think you need to, um, where depending on where you live, try to find out where is the best place I can get care for my sickle cell disease. Sickle cell disease is really common in Nigeria compared to the United States.
Um, in your experience with like hearing people's experiences with their sex life, is sex life and sex drive and sickle cell disease different from healthy individuals?
Uh, I don't think so. I don't, I, you know, there are issues with men who have priapism, but I don't know that that affects your sex drive more than anything else. Although I will say, I'm not a psychologist I don't know, but I can just say this. A lot of people with sickle cell disease they have a chronic illness and they're sometimes depressed, they're in the hospital a lot, and your mood could affect your libido. Also, if you're on chronic opioids, that will decrease your libido as well. So if you take opioids every single day, that could affect your libido. So those and the thing is, you should. We've talked about this before, but people with sickle cell disease should have some kind of therapist, especially if they're struggling with their disease, to help them with that. And if you're on chronic opioid therapy every single day, you should um, have pain a pain expert try to manage your pain so you're uh, to optimizing your pain management and maybe not taking something rather than opioids.
Yeah, what I will say about it is, fatigue plays a big role in sex drive as well. And since a lot of us are so fatigued, that could play a role too. So I wouldn't necessarily, I do feel like just there would be a difference between, individuals without sickle cell and individuals with sickle cell in terms of sex drive. Just due to the fact of like fatigue and anemia being a thing within sickle cell. So take that for what you will. And yeah, we had a post, I want to say probably about 2 years ago around, um, just some of the challenges for, intimacy in that way, I guess, for people living with sickle cell, whereas like, sex could be a trigger for some people. It could put them in a pain crisis. People talk about staying hydrated because, also overexertion can be a trigger. So there's a lot that goes into, that, and it's a thing within sickle cell. Hopefully that answers your question. Um, Somebody asked, is there a cure for sickle cell yet?
Oh, what? Cure?
Is there a cure for sickle cell yet?
Yeah,
And
well,
I,
bone
yeah.
marrow transplant is a cure. It's been around a long time. It requires a donor, so you have to have an HLA matched donor, or like we were talking about, a haploidentical donor. And then there's gene therapy, where you are your own donor, so you don't have to look for a donor. You're the donor. So in gene therapy, they take your progenitor cells, the stem cells that make all the different cells in your blood, and they treat those with different types of gene therapy medications, and they give it back to you. And either you have a really high level of fetal hemoglobin on some with some of these treatments, and so the level is so high that you have no symptoms of your sickle cell disease. And in the other treatment that's been approved, they insert uh, a hemoglobin DNA that makes a special hemoglobin that was developed not to sickle, so it inhibits sickling. And both of these are very effective. Um, they're very high tech, very technologically uh, dependent on having, laboratories where they can do the gene therapy, the collection. You have to have a hospital where people know about the gene therapy, where they know how to take care of people with sickle cell disease. They have the ability to collect the cells and send them off. So not not every hospital, maybe not even a hospital in your state, may not be able to do gene therapy. Um, and I've read, although it may, hopefully it's changed, but when these treatments were first approved by the FDA, it was estimated that only 100 people a year would be able to get gene therapy because it's so complicated and there were so few places that were authorized to do gene therapy that it really limited the number of people who could get it. It's very expensive, in the millions of dollars per treatment, you know, but a independent um, group determined that it was cost effective. So, like, insurance companies don't like to spend a lot of money to take care of illness, but this independent institution determined that gene therapy, as expensive as it was cost effective. So so it kind of opened the door for insurance companies to think about uh, adding that to their uh, list of things that were covered.
Um, this question says, I had leg ulcers for 2 years. When will they heal? What's best to help?
Leg ulcers are really, really difficult to heal. Sometimes you actually need plastic surgery to get skin grafts over, depending on how big they are, to help them heal. Um, they, they when they do heal, this person who has these probably knows this, but when they do heal, the skin over that heals up over that ulcer is very friable. It's really thin. It's not like normal skin. And so that it's likely if it's not, protected, that it could actually create another ulcer could appear right in that same area. Um, so it requires people who are trained to take care of skin lesions, and there are uh, there are actually specialists in a big city. There would be people who would know how to take care of those ulcers. The problem with them is that once they happen, they reoccur. So um, it's a huge problem for people who have these. Um, and not everybody has them. I'm not sure that people know why. Well, if you're in somewhere like in a tropical climate and you don't wear shoes or wear flip-flops all the time, people banging your ankles and your legs, that will, with sickle cell disease, that could lead to skin ulcers. But in other countries like here, I'm not sure. I'm not sure people know exactly why skin ulcers start if there isn't injury to begin with. They're extremely painful for people who don't have them. They are really difficult to treat, and they're very, very painful. But it requires a specialist, a skin specialist to be able to take care of those. And it takes a long time for them to heal, years sometimes, and they do reoccur.
Why do some people with sickle cell have a high hemoglobin and a low hemoglobin?
I mean, why did some people have high and some people have low?
Yeah.
Well, if you have fetal hemoglobin decreases um, hemolysis, so you're going to have a higher hemoglobin. And there are people who have hereditary persistence of fetal hemoglobin, and those people are going to have a higher hemoglobin. It also depends on your diagnosis. So when you say sickle cell disease, you're talking about hemoglobin SC, hemoglobin SS, hemoglobin beta thalassemia. So there are different types of sickle cell disease, and depending on what your diagnosis is, you will have a higher or lower hemoglobin. So people with S beta plus thalassemia will have a higher hemoglobin because they have a certain level of hemoglobin A. People with high fetal hemoglobin normally, they inherited maybe not hereditary persistence of fetal hemoglobin, which is a mutation, but they just have a high fetal hemoglobin for whatever reason. Those people will have a higher hemoglobin. Some people it's not clear why some people, to me anyway, maybe it's clear to other people, but why some people have more hemolysis than others. So um, there's a huge range between the lowest hemoglobin and the highest hemoglobin for people who have sickle cell disease. A lot of it depends on what your diagnosis is.
So there's different types of sickle cell disease, and each type kind of has its own range of hemoglobin. So some
Right.
types have higher hemoglobin and some types have lower. Okay. Do you know anything about hemophilia, Dr. Q?
No.
No? Okay. We have a question about somebody who what a parent should know about for caring for a child with hemophilia in Nairobi, Kenya. Um, sorry, we that would be outside of our expertise. I don't know if you have anything to say about that.
No, I don't. I wouldn't pretend to know anything about hemophilia. I did not take care of kids with hemophilia. And it requires a hemophilia. There are doctors who, like I only did sickle cell, there are doctors who only do hemophilia.
Hemophilia. Okay.
Yeah.
What do you think the best way to distress as a sickle cell patient?
The best way to what?
De-stress. I like that question. What's the
Oh,
best way to de
de-stress.
Yes.
Oh, uh, I I think if you really, we talk about this a lot, but I think people need to have some kind of a therapist if they have sickle cell disease, especially if they have a lot of stress and anxiety, which I think, it depends on your personality, but I think if I had sickle cell disease, I'm kind of one of those people. I'd be pretty stressed out about it. And I would probably want to be talking to a therapist about what can I do to decrease the level of my stress. Um, and I think that's like I can't really unless you have a very close friend or partner who's really good at understanding you and talking to you and decreasing your level of anxiety and stress. I think you need to have a therapist, someone who's trained to help you de help you cope with stress without medications. So you can't take medication for stress, but it would be nice to have someone to help you not be able to deal with your stress without taking medication.
Yeah. You can also, just listen, in addition to what Dr. Q said, listen to your body and, how it responds to different situations. So, one way, if I'm feeling stressed out, I like to play my Nintendo Switch. And I like to play this really calming game called Animal Crossing. And it's like you can build your own island and it has just like infinite options of things that you can do to like you're like the mayor of the island. So my husband calls me mayor because I manage Animal Crossing Island. That always helps me de-stress. Like I'm always like at peace when I'm playing Animal Crossing. I'm always at peace when like I'm listening to certain types of music, right? And so it's always a good idea to kind of just understand your body in that way and understand like what, brings you down, what sometimes it's taking a walk outside, sometimes it's laying in bed for 20 minutes under with your heating pad. I don't know. But yeah, just find ways to learn that about yourself because it's important within sickle cell as stress is a trigger for sickle cell. So
And if you live near an open area, I think if you're just taking a hike or sitting and listening to birds and out in the woods somewhere, I think some people would find that very helpful to decrease your stress.
I quickly want to answer this question, just to kind of do our PSA. It says, my 2-year-old daughter, her left eye is always watery.
Hmm.
That's not sickle cell related, is
No,
it?
it's not sickle cell related. I'm just thinking, if it's like she's tearing out of that eye all the time and she doesn't 2-year-olds aren't very verbal, so I would take that child to a pediatrician or even an ophthalmologist to make sure there wasn't something irritating her eye that was causing her to tear a lot. You tear a lot if you have, something aggravating your eye, like a little piece of dust or something. Um, so that's not sickle cell, but it's not normal either. You should have someone take a look at that, especially if the eye looks red or something, where there looks like there's irritation.
Yeah. Which is why it's important to have a primary care physician too outside of your sickle cell because, you know, we are not exempt, us living with sickle cell are not exempt from other health problems. And a lot of times, we like to blame everything on sickle cell, and doctors like to blame everything on sickle cell, but not everything is sickle cell. So just keep an open mind to whatever else things could, whatever else problem could be, and make sure you are in contact with your provider, your primary care physician, who will handle everything outside of sickle cell. And don't put it all on your hematologist, I'm told.
Oh,
Because
I mean,
my
I think, hematologists are doctors, but they don't do general practice. So I mean, they know stuff, but they don't, they're focused on people who have a specific problem rather than just general medical kind of stuff.
All right. I'm going to attempt to pronounce this word that I have no idea how to pronounce, and I think that'll be our last question for the live, unless anybody has like, okay, I see one more question. I'll cut it off there. The how do people with sickle cell make money? Because that's an excellent question. Um, so somebody says I have acute cholecystitis and my liver is measuring at 18.3. What's the best treatment? My hematologist isn't taking me seriously.
Well, I I
Did I
think you're
pronounce that word right, by the way?
cholecystitis, yeah.
Is cholecystitis? Okay.
Yeah, it's inflammation of
Okay.
the biliary tract. I think that's what the
Okay.
person is talking about. But that's something that you need to see a specialist about. There are actually people who are hepatologists, and that's a person who deals with the liver. Um, a gastroenterologist would know something about how to deal with that.
So it
Um,
wouldn't be your hematologist dealing with
Not
that, long
necessarily,
story
no. I
short.
mean, if I had someone when I had someone with like, you know, inflammation of the bile ducts or a liver problem, I would personally ask the advice of a gastroenterologist or a hepatologist, and they'd say, well, why don't you do these labs and then send that patient to me, and then I'll take care of it. So that's what you need. You need to probably have some imaging, laboratory work done, and then be referred to uh, a specialist. What I like to do would be to talk to the specialist first and find out what they would, if they had anything they would like done before the patient got there. So to me, it's kind of, this is my personal opinion, it's kind of a waste of time to send somebody to a specialist who then says, well, I need to do all these lab tests before I can tell you what's wrong with you. It'd be much better if your doctor talked to the specialist first and said, I've got this problem. Is there any labs that I should have this person do or imaging before they
Beforehand.
come to see you?
Yeah.
And then you can look at the x-rays or whatever, CT, whatever, look at the lab work and say,
Yeah.
oh, yeah, I know what this is. And then you do give them
It's
a
just more
heads up.
efficient.
Yeah, I mean, it's like you go and then they say, well, why don't you come back in 3 weeks after you have
Yeah, that's
these tests?
terrible.
That's like, wow,
Yeah.
that's not very effective way to take care of people.
All right, how are you all making money? Let's hear how you're making money. I got my notebook out here. I'm gonna take some tips. Dr. Q, what thoughts or how have you seen people make money with sickle cell?
Well, some people have a community-based organization, but that's that's really time intensive. I mean, ask Cassandra. It's really time intensive. It's like a thing. I've had, let me think. I've had people who work in food service in restaurants who had sickle cell disease, people who have office type jobs. Uh, I actually had a patient this is a young lady who wanted to be an electrician, and she became I don't know how they classify it, but she was like learning to be a journeyman electrician, and she couldn't really she after a couple of years she had to stop because she was outside all the time, and they would be in like
Yeah.
really big buildings. There'd be no walls, so the weather was just coming right at her, so she had to quit doing that. um, you have to find a job where you aren't on your feet all the time, because or you can't be lifting heavy weights because that's not going to be good for your hips. There's there's a lot of jobs that are kind of low impact, and you get a chance to rest. The other thing is, if you do get a job, you a lot of people, I think, well, not a lot of people, but I did know a few people who wouldn't tell their employer they had sickle cell disease. And then when they got sick, the employer's like, hey, you didn't tell me that you were going to be gone for, 3 or 4 days at a time or whatever. And I think, there's the American Disabilities Act, so they can't not hire you because you have sickle cell disease, but you have to let your employer know that, you know, what to expect. And it does have to be sort of a low impact, indoor kind of job. Because if it's really hot out, you can't, you could be a gardener or something, but depending on where you live, like in the Bay Area, you could be a gardener because the weather's the same all the time. But if you were in, you know, New England or something, or in the South, it could be really too hot for you to do that. It's hard to find a job when you have a sickle cell disease, but there are a lot of jobs available.
Yeah, I always encourage people to be their own boss with sickle cell because sickle cell is so unpredictable. And so any job that deals with like, working from a computer, it could be coding. We have a lot of artists, we have a lot of digital graphic artists. Any job in which you can kind of set your own hours is ideal, because that's I the way I designed what I do now is I could work from a hospital bed if I needed to. And so that's worked out for me. And I realized that a conventional job um wouldn't be the easiest, right? Or isn't the easiest for a lot of us. And so um you have to find a way around that. And we're very creative people. So but I would always encourage anybody, like, freelancing, anything that allows you to work from a computer, from the comfort of your home, and you don't have to, kind of get out of the house, or you don't have to travel far. Um, that's always really helpful.
How do you do the financial part of it, like keeping track of, your finances, the money coming in? You don't, if your I know if your income fluctuates, then
Yeah.
your income tax thing is kind of a hassle. Who do you have someone like would recommend that? Do you think people need to have like a tax person or somebody to help them with all that kind of
Yeah,
stuff?
if you're, so it depends on if you're an employee or a contractor. If you're a contractor, then you kind of have to set aside some wages for taxes to pay later on. If you're a W-2 or an employee, then whoever is employing you will take out those taxes for you. Um, so it just depends on how it's set up. I think a lot of us are freelancers, which are like contract jobs, and so whatever you earn, you have to set aside half of that money. I'm conservative. I say half, right? But it's dependent upon whatever state you're in. I think here in California it's like 30% or something like that. Um, but you do have to set aside a certain amount of money so that you can um, pay that off for taxes. So yeah, there's definitely ways. if you're unable to work, period, then maybe you're eligible for disability. That's also another option. Disability is really hard to get. But actually, I was in DC last year, probably around this time at a HHS sickle cell symposium, and there was somebody from, and I don't know where things are now with the current administration, but they were prioritizing um, just getting disability for people specifically with sickle cell. They had like a getting disability with sickle cell handbook. And so I know that was something that they prioritized last year. And so hopefully it's a little bit easier for individuals with sickle cell to get disability. Um, but yeah, you have to kind of look at what resources are available to you also as, just somebody living with a disability. And then with that, try and build your own kind of job or build your own kind of like employment circumstance, which is what I've done.
And I almost think if you have access to a social worker in your hospital or whatever, it's hard to apply for disability. It takes a lot of effort and it could be very frustrating. But if you have a social worker, they know how to do that and they can help you do it. My experience or impression was it was really hard to do. You couldn't really do it by yourself. You needed someone to help you do it because they wanted a lot of info. And in California, every year you have to say, oh, I still have sickle cell disease, so I still qualify. So which is very weird since you have sickle cell forever, but the state seemed to think that you needed to remind them that you still had sickle cell. So there's a lot that goes into getting disability.
Somebody said they're in nursing and it's scary being that our immune system is compromised. And that was exactly, I at once upon a time I wanted to be a doctor, but then I was like, what do I look like getting sick with everybody else? Like, and I have sickle cell. I don't know. So I get it completely. But a lot of us, like I guess conversely, a lot of us want to go into medicine because we understand it so well, right? And we know what good looks like and what good should be, and would probably be the best providers ever. So it's definitely tough.
But there's a lot of things in medicine. You could be a social worker, you could be a psychologist, you could be a nursing assistant, you could, work in a sickle cell clinic. I mean, I learned a lot about sickle cell disease, not from books, but from people telling me what was going on with them. And so you could be a really in a hospital that had people who had sickle cell disease as part of their population, you could really help those people and the caretakers, the per, providers, um, learn more about sickle cell. The other thing is providers don't really see people with sickle cell disease when they're not sick. And their impression of people with sickle cell disease is they're sick all the time. And so just by being in that environment and, being like, a normal person, they change their attitudes towards sickle cell disease.
I was told that people with sickle cell are really smart. I would have to agree. Um, because we use, the one muscle that we can use confidently is our brain here, right? They tell us to stay inside, don't do PE, don't do recess, don't do like, which isn't true, right? You can develop your other muscles. But for those who might have an issue with that for any reason, we are definitely smart people and very creative too. Like you see a lot of musicians and artists and within sickle cell poets. Like, yeah, we're we definitely have that advantage. They should put that in the textbooks. I'm playing. But yes, I do notice a correlation. All right. Oh no, I am so sorry.
Yeah.
Oh my gosh, that is so heartbreaking. I'm so sorry. Praying for your strength in that. That's really tough. Um, and my condolences. I'm so so sorry. All right. We are going to go ahead and wrap up. Dr. Q, do you want to share your statement with
Yes.
the rest of us?
So everything, sickle cell 101 is all about advice, and information. So we everything that we say or that I say in this program is just my opinion, and it's trying to educate you about sickle cell disease and answer your questions as best that I can. Other people who take care of individuals with sickle cell disease may have different opinions than I do, but what you hear from me is just my opinion. I'm not trying to even though I do talk about hydroxyurea a lot, I'm not advocating that you take hydroxyurea. You need to talk to your primary care doctor to see if that's the therapy for you. And I'm just trying to educate people about the different treatments for sickle cell disease and answer your questions as honestly as I can about the things that you ask us. And I appreciate everybody that comes on and asks questions. It's the way the sickle cell community um, gets information and the way you support each other. And the people who I see scrolling with they really support each other, which is really nice.
Yeah. Somebody said we need more time. We are going to be doing a 24-hour. Y'all are gonna
Oh
have to keep
yeah.
me
Oh
awake.
yeah.
You will have to keep me awake. A 24-hour Ask the Experts for World Sickle Cell Day, this June 19th. So stay tuned. We do this at a certain time, and not everybody has access to us at this time. So we want to make sure that we can do this over an extended amount of time. You guys can ask all the questions you want to ask and like really work Dr. Q's brain, and yes, and it'll
His
be
brain
fun.
might not be working
24
after.
hours, yes. I will have coffee and I will have my Trader Joe's little energy juice shot and I'll be good to go. I'll be good, I think. But let us know if there are any topics that you all want us to cover and see. I think we're gonna divide it into different topics and invite so that it's not all Dr. Q. Invite people to other, specialties to join and answer questions as well. So, um, somebody asked again about having a child with sickle cell causing miscarriage. It does not. There's no correlation. You might have you might have missed that when we answered earlier on. And I don't know anything about colloidal copper and gold as it pertains to sickle cell. Do you, Dr. Q?
No, no.
No? Okay. I know that they have like antibacterial, copper has antibacterial properties, but that's about it. Like I used to have one little thing on my keychain and I would just carry, I don't know if it worked, but like I like the idea of like having access to something antibacterial that probably got scammed out of that, but yeah. All right, guys, have a wonderful weekend.
Okay. Bye-bye,
Please be sure
everybody.
to rest and we will see you guys next time. Take care.
Bye-bye.
Bye.